Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. Welcome to our Friday Q&As. If you have not yet had a chance to subscribe to the channel, please do so. I would appreciate your support. If you don't yet follow me on Instagram, also please do so. I would very much appreciate your support on there as well. Also, the Circle of Trans Womanhood is opening up its doors tomorrow. So if you're interested, there's a link below, gives you all of the information. If you are a woman with transgender history and you want to join the membership and mentorship program, link is below. Check it out. It is a great way to connect. And there's going to be over 15 plus workshops on connecting, exploring, discovering your trans womanhood, created, recorded by me, very different from YouTube videos. So check it out. For today's Q&As, I have selected, there were some questions lately that a little bit more context oriented, a little bit more lensly. I encourage all of you, if you want to participate, all you gotta do is email me your question, link is below in the description box, but make sure you keep it short. For this one, I selected 4 random ones. They all ended up being relatively larger than usual. Usually I do 5 questions. I'm just going to do 4 today because I have a feeling that we're going to get really in depth with this. There's a lot of context here. These are all really good questions, and a lot of them, if not all of them, have to do with confusion around identity. And so this is going to be a really great deep dive for all of us. So without further ado, there's always timestamps, and I have blocked out any identifiable names or email addresses, so keeping it all very private. And we're gonna get started. So I'm gonna put question on screen as per usual for you to follow along. Question number 1. I'm 42 years old, trans feminine, non-binary. I started my medical transition, laser, hair removal, and hormones 2 years ago. But I haven't done much about my social transition except using they, them pronouns. I grew up in a very conservative country, and it took me decades to accept my trans identity and to start addressing it. I have struggled with bodily dysphoria since early childhood, and it has always been obvious that I am not a boy, even if I have spent decades trying to perform masculinity just to stay out of trouble. And I don't have masculine interests at the same time. I have never felt like I belonged with the girls and never been interested in girly stuff either, like playing with dolls. I was wondering if I might be a trans woman in denial. My questions are the following. I think, am I unconsciously bargaining with my internalized transphobia when I identify as non-binary? Am I avoiding to identify as a woman because I'm fully aware that I will never ever pass no matter how hard I try? What are the key questions to ask myself to determine if I am not a trans woman in denial? This is a very good question. The reason why this is such a good question is because it is going to be so relevant to so many of you. So many of you do wonder to what extent even what you identify, like this person, trans feminine, non-binary, or non-binary femme, or gender fluid, to what extent your non-binary leanings may be a way of self-denial, maybe a way of you bargaining with yourself, or maybe your way of preventing yourself owning up who you are. These are all going to be very common for a lot of you. It's very common for people, period. So this is a great question, and I think the key question here is, well, first, to answer your question, am I unconsciously bargaining with my internalized transphobia when I identify as non-binary? That's possible. Possible. Especially bargaining as a way of avoiding stepping into your authentic self. I often see, let's put it this way, I often see most common happening to individuals who feel, whether it's true or not, who feel that they have more to lose. Now, the perception of losing things in our life is very subjective, right? But I oftentimes see this being a bigger concern of people who feel that they have created this huge world around that revolves around their assigned gender identity, careers. I see people who maybe their careers, like they're public figures. I work with people who are a little bit more in a public platform where they're visible to others, or when they have big businesses, big families. In other words, they feel like they have a lot of ties that are associated with their assigned gender. And as a result, they feel like they have more to lose. Again, like I said, what we stand to lose is very subjective. For somebody, just going through transition and going through pains and gains of it is something to lose too. But I see bargaining happening when people experience that type of mindset. Oh, I have more to lose. And it is very common, in fact, to then, as a byproduct of bargaining, and I see this a lot, people will start entertaining notions or ideas. I'm smiling because I spot it so often, of this like middle spectrum identity, because they feel like that's safer. They feel that way they can express themselves without really doing anything else. It's almost a psychological defense, and it becomes a way to convince oneself that, see, I am doing something, I am exploring, I'm not just fully, completely in a binary of my assigned gender. And that just shows me by doing it that I don't need to do anything more. That just shows me that I don't need to step into any other further related things. Very common. So that's to answer question number one. Could you be bargaining with internalized transphobia? Also with internalized transphobia? Yes, of course. The more a person has internalized attachments to what it means to be a trans person, the bigger their fear orbit is going to be. And that just makes sense, right? It's just logical. So pay attention to you internalized stuff that all of you, myself included, all of us care about trans people. The easiest way to find out what you're carrying that might be internalized transphobic stuff is just, first of all, sit down and see if you can write down. When I think of a trans person, I think and write everything that comes to mind. This is one of the ways. Another way is catch yourself anytime you are engaging in judging internally. It doesn't have to be, malicious outward. Hopefully not. Let's all be better people. But when you catch yourself internally in your headspace, when you see somebody, maybe you see somebody on social media, a trans person, and you catch yourself judging that person, the minute you catch yourself, that's your internalized transphobia token. So pay attention to that. The second question is, am I avoiding to identify as a woman because I'm fully aware that I will never ever pass no matter how hard I try? Also, yes, very possible. When people feel a sense of certainty, whether that certainty is true or not, and oftentimes it is not true, oftentimes it is tied to your biggest fear, and oftentimes it is tied to you looking at yourself through the lens, very distorted lens of gender dysphoria, which is a very self-critical lens. A lot of you will have perceptions out there that you will never ever pass, you will never look like women, you will never look beautiful, you will never look attractive, you will never look fill in the blank. And every time I hear a client that I work with tell me that, I can see the magnitude of how distorted it is. Now, I'm not saying that we all have got to be, how should I say it, Pollyannish positive and dismiss objective aspects of being exposed to testosterone over decades and decades and how it has masculinized you. And the reality is that feminizing hormones are gonna do certain things, but not all of those things. Or the reality is that maybe you don't have access to surgeries and as a result may not fully feminize. There's a difference between objectively recognizing limitations and also holding an open space for opportunity of your feminine self to come through versus strongly believing it will never happen for you, because it happens to everybody. Feminization and stepping into your womanhood. Yes, hormones play a role for some people. Yes, surgeries undeniably play a role for sure. Also, what a lot of things that play a role is not only how you express yourself in feminine way, but also how you start feeling about yourself. So I see this a lot where if you strongly believe you will never ever pass, you're going to start then trying to justify and rationalize by moving your mind away from possibility of authentically living your life, possibility of transitioning. Sorry, I had to move a little bit. Very particular here. Very common. But you have to ask yourself if you're looking at yourself objectively or if this is a distorted eye of dysphoria talking. Another question here is, what is the key questions to ask myself to determine if I'm not trans woman in denial? This is a really golden question in this question. Thank you for asking this. This is phenomenal. So what is the key? A lot of times we say, what is the key question to ask to whatever? But this is interesting because what questions to ask determine you are not trans woman in denial, right? It's almost like reverse of the equation. So before you even start getting into whether you are in denial or not, trying to get at the root of whether you are in denial is much more challenging because a lot of times denial can operate on unconscious wavelengths. And when we are engaging in denial tactics, we're less aware of it. Versus when somebody can spot denial within ourselves. So let's leave denial now for a little bit. Let's shelf it for a second here. Now, what can you ask yourself to determine you're not a trans woman? Always square one. Square one for all of you is going to be your assigned gender at birth. How do you feel about your assigned gender at birth? It's very easy to get lost and confused when you start thinking about, I like feminine things, I like to express myself feminine, I used to enjoy playing with dolls, or I used to not enjoy playing with dolls, or I don't have a strong dysphoria toward my genitals, so therefore I'm not a trans woman, or it's so easy to get confused and lost in all of those things. Because a lot of them will point at different directions, but they can only point at one direction if you're orienting from square one. And square one, how do you feel about your assigned gender at birth? I had so many people come to me that will tell me, I like to feminize, I get pleasure out of feminizing, I get sexual drive from feminizing, I get peace of mind, sometimes I enjoy it, it's so much more creative. And they have created this whole narrative around this various aspects of feminizing and how it makes them feel. And they come to me thinking, I'm trans woman and I need to transition, right? And the minute I ask them, well, how do you feel about your assigned gender at birth? How do you feel about your male identity? How do you feel about living a life as a man? That's when the whole narrative starts to crumble, because not for everybody, but for some people, they realize that, oh, I actually like being a man. I like being a guy. I like navigating my lives that way. And then the second confusion comes up. But if I'm comfortable being a guy, what does it mean that I'm also comfortable doing all of this? That just means that. That just means that there's your core gender that you're comfortable with. Great. And there's all of these activities that are part of your character, part of your, even part of your being, but not necessarily tied to your gender identity. Maybe they're more tied to your gender role or how you want to express yourself, or just there's simple gender specific activities you enjoy doing. So this question, how do I determine I'm not a trans woman? The answer is square one. How do you feel about your assigned gender at birth? And if you're not sure, start writing about it. Try to get more specific. Not just how do I feel about being a man, for example, but how do I feel about secondary sex characteristics? How do I feel about when I'm being gendered as man? How do I feel about when I'm navigating life as man? What about it that bothers me? What about it I feel neutral about? Now, the second thing that I shelved, how to determine if you're not in denial. Like I said, it's not easy because a lot of times you're not aware. And we as human beings are the biggest salespeople to ourselves. We'll justify everything to ourselves. So it's really hard to spot. But one of the ways to spot is if there's a contradiction to denial. Meaning, are you telling yourself one thing and then immediately on the split side thinking about the contradictory aspect of it? For example, are you constantly toying with the thought process, I must be a trans woman because I'm doing A, B, C, D, and at the same time, I can be a trans woman because I'm doing EFG. Contradiction always point out something about your mental processes is not in alignment with you. And so somehow you're keeping yourself in position of denial. So this is another way. You see, this is why we needed 4 questions today. This is already, I see, it looks like 17 minutes in and just the first question. But this is a really good question. And more exploration is warranted. Hopefully this gave you some of the answers, but this is not very clear cut. Great question. Question number 2. Short backstory. My ex cracked roughly 2 months ago after I started questioning actively at the turn of 2025, since I figured out I am trans, assigned male at birth, and would strongly prefer to be a woman, I have done small amounts of exploration as well as taken better care of myself. So there's some weight loss, shaving beard, shaving legs, tried unfeminine clothing. I'm currently in the talks with my GP, general provider, about getting me on the wait list for hormones. Question. I believe I'm engaging in avoidant behavior around my gender exploration. I consciously avoid feminizing activities because I know seeing myself in mirrors will cause intense dysphoria due to my masculine features, which only happens when I try to look like a woman. I'm terrified of starting transition with poor starting conditions, likely needing FFS. See how very self-critical all of you are, and ending up feeling worse than I do now. So avoid experimenting altogether. How can I work through this avoidant pattern when my perfectionism as well as fear of men in dress and inadequate results keeps me stuck in a cycle of inaction? Great question. Almost feels like a segment to the first question, right? An addition to the first question. So first of all, when you say, I believe I'm engaging in avoidant behavior, I would agree with you. It does sound like you are avoiding to pushing the envelope, you're avoiding to exploring more. Primarily, things you've done are fantastic starting points. So give yourself a pat on the back. They're really, really great. You've done things that seem to matter to you, right? Seems like you were dissatisfied with your weight, so you lost some weight. And you tried what it feels like to shave your legs, to shave your beard. And you also tried on feminine clothing. These are all fantastic things. but you also keeping yourself from stepping a little bit more into exploration, because it sounds like what comes up for you, which what happens for a lot of people, especially when their egg suddenly cracks, is again this inner stuff coming up. We all have inner garbage about that is not true, that is inaccurate about specifically trans women. We seldom have garbage about trans men, but trans women, yes. Why? Media, films, movies, to this day, perpetuate the narrative of trans woman is a man in a dress, or man who is making a caricature of themselves as a woman. Or trans women are deceiving, therefore they're pretending, and therefore they're not real women. Ace Ventura, right? This is the movie I grew up with. Anybody remembers that scene in Ace Ventura? Bachelorette's Party. Oh my God, I grew up with that one too. There's a scene in there. Anybody have seen it? I'm not even going to mention that scene. These things, when you grow up with this messaging, it creates almost like an internal idea, internal schema, internal image of a trans woman specifically. And even as you grow up, you realize that that's not true, that that's toxic, that that's not accurate. It's still there, and it still comes up for you. This is what internalized transphobia is. When we're taking stuff without even consciously from external world, all the messages about trans people, and we internalize them, and for a lot of you, those messages start turning against themselves. So you start seeing yourself through the lens of those messages. So it is very common for people, for adults, especially when their egg cracks and they're older, and they start exploring themselves and they start feminizing. And I have a video on this. When you feminize, and instead of feeling euphoric, and some people do feel euphoric, some people can do it just fine, but a lot of people actually have the opposite reaction. They look in a mirror and they don't see a woman. They don't see their feminine self yet. They see through the lens of distorted dysphoria and through the lens of internalized transphobia. And what they see is what they're afraid to look like, what they've been told by society and culture, men in a dress. Again, not everybody, but a lot of people do. And that, in of itself, just experiencing that, sends a lot of people into regression, where they just take it all off and they say, no, not going to happen. It's never going to happen for me. I'm never going to look feminine. I'm never going to look like a woman. And this is part of what's holding you back. And you already acknowledge it in here. You're already acknowledging it in here. What I would recommend and encourage for you to do, because one of your question is, how can you work through this avoidant pattern? And I know there's a lot of you are very perfectionistic, by the way, you're not the only one. A lot of you, I have people who tell me, unless I can look absolutely really, really attractive as a woman, I'm not doing any of this. The truth is, a lot of you don't know. There's no crystal ball. You don't know. You have to trust the process. The truth is, a lot of you start off with this idea that unless I will look pretty. But as you start moving forward, you realize that pretty matters. Sure, being attractive matters. But you start to realize what matters more is how much more happier you live, how much healthier you live, how much more joyful your life is. That's, my friends, are priceless. That's when you start experiencing shift from, I gotta look really, really gorgeous, to, I'm gonna do my best, but I'm already so much happier. But you can't experience so much happier until you take little steps. So my advice for this is, first, be gentle with yourself. This is not an approach where you can apply perfectionistic mindset. This is not an approach where you can apply controlling mindset. I mentioned this before. So many of my clients, so many trans women I work with want to approach transition the way a man would approach solving a problem. I gotta fix it, and I gotta know how it turns out, and I gotta have a clear plan, and if I don't have these three things, I'm not doing it. And I get it. A lot of you have been culturally brought up from that lens, culture brought up to think like that. Transition is feminine, it is organic, it is flow. It's a river that you gotta be stepping in again and again and trust that it will take you where you need to go. So I encourage for you to be gentle with yourself, to be kind to yourself, to be compassionate to yourself, to trust the process. Start slow. If you really have a lot of internalized transphobia and you're afraid, start slow. Start slowly by, I always recommend for people to push their self-expression more toward like androgynous. Start slowly showing up androgynously. Build up that confidence. And as you feel confident, push the envelope more and push it more. And that's how you're going to break through avoidant behavior. The way out of avoidance is action. The way out of fear, action. So think about that. Great question. Hopefully that answer helps you or gives you some guidance. Question number 3. One moment. Question number 3. I am male to female, and here's question for you. I'm later trans person, almost 40, and knew since I was a kid, but just recently realized we've been married. I'm like jumping the gun. But just recently realized, so almost 40, knew since you were a kid, but recently became to that realization. We've been married for over 10 years now to the love of my life. She's been very supportive of my tradition, but has doubts about where our relationship will go. She's read plenty of different experiences where other trans people have gone from their previous hetero relationship to the trans person going male to female, and now into males. And everything in between. Okay. I've not started hormones, but know firmly that I am transbian. I've been dating lesbian girls as a man and am firmly into the lesbian category, but I can't convince her that things won't turn out differently. I'm worried about moving forward with my transition and don't want to wreck a relationship that is a part of who I am regardless. Any advice on how to move forward? So if I understand this correctly, because this is not super clear, you are a trans woman, transbian, trans lesbian, because as a woman, you prefer sexually women, right? That makes you a lesbian. And you are married to a love of your life. You're referring to her as she, so feminine. So sounds like the question is, your partner, your wife, is the one who is worried that your maybe sexuality might change or shift, or that you might no longer be attracted to her or desire her or want her and might want to have sexual relationship with man. I'm assuming this is the core of the question. And you're worried about moving forward with your transition and don't want to wreck relationship. I'm trying to reread it to see if I missed anything. So yeah, that's what I'm getting from it. And correct me if I'm wrong. You're welcome to rewrite this question and email me if that's not what you're asking. But this is the gist that I'm getting. So the gist I'm getting is that you're married to your wife is, I'm assuming, a woman, identifies maybe as a woman, and you know yourself that you're attracted only to women, that you're a lesbian yourself, but there's the worry and concern that she has worry and concern that your sexuality might change, how to proceed. Again, no crystal ball. For some people, their sexuality does change. I've worked with people who swore they're lesbians, and as they start transitioning, what usually happens is that, and I say this many times, you don't often know your full sexuality and your full range of sexual preferences until you're also in touch with your core self. And for a lot of people, as they transition, they realize that now, as women, wow, they never thought about it. They realize they're really attracted to men, or both men and women, which makes them bisexual. The truth is, people don't know. They assume they know. Everybody makes assumptions. But nobody knows for sure until they actually go through some elements of gender transition, whatever that is for you. So this is just all about, not only sexuality, but also acknowledging that, you're in a relationship, you still find your wife attractive, both sexually, intimately, but also there's connection there for two of you, there's devotion there. And to trust the process, that if you're going to find out you also tend to be attracted to men as well, just acknowledge that part of your sexual attraction. You don't have to explore it or act on it. Many people, regardless of their gender experiences, in a scope of relationship, in a scope of a marriage, down the road realize that their sexuality is more fluid, realize that they're actually attracted more to different partners. And sometimes they open up their marriage to it, to explore it, and sometimes they don't. Sometimes they just acknowledge that I have those desires and maybe I'll just keep them in a fantasy realm, but I'm in a committed relationship and I don't need to necessarily going out there exploring them because that's not something that me and my partner agrees on, right? Not everything that we come into life and experience has to be necessarily fully explored, has to be fully, I think if there's opportunity and if there's situations that allows for that, that's great. But if not, we also have to respect and honor that not everything is for us, right? So I'm not going to go with that example. It's not going to be relevant. But so I would recommend for you, just take it slowly, acknowledge that possibility might come up and talk to your wife also about it and just say that, look, right now, what I do know is that I'm strongly attracted to women. I don't expect it to change. But if things start to shift and change, we're going to have a conversation about it. And I'm going to be as open to you about it as I can too. Once you open the dialogue, you're also allowing her room to make her own choices and to open the possibilities as well of then deciding what would be the best for her. That's what I would recommend. But this is a great question, and the truth is nobody has a crystal ball. You just don't know. For some people it changed. For some people their sexuality never changed. They're still attracted only to women partners, period. You won't know until you actually have more experiences of yourself embodying your authentic gender. Great question. And finally, question number 4 for today. Another big question, so let's go through this together. Thank you so much for your work and your videos. They helped me a lot so far. You are so welcome. All of you so welcome. I really enjoy doing it. Personally, I am unsure if I'm gender fluid or trans female. See, lots of questions. All of these questions are about a core of identity. I am in a situation that almost seems common to you. I came out to my wife and she gave me an ultimatum, no hormones or surgery. As a reaction, I shifted from trans to gender fluid identity. And I do feel male validation within our relationship. But outside of that, I more and more often feel a yearning to be a woman. I don't want to rush in head first and potentially ruin my marriage completely. How can I differentiate being truly gender fluid from being transhuman with fluctuating dysphoria. This is so, so good. So, so good. It's so good because it is so common for so many of you. Yes, this is very common to me. And there's few things here on the table for this question. And I want you to consider them both. And for those of you who are in the same situation, I want you to also acknowledge both of those. One of the things that's here on the table is that when people are, this is from my experience, when people are in a relationship and they want to hold on to that relationship is meaningful to them, they don't want to lose it. When they come out to their partners and when their partners issue an ultimatum, especially not just a more flexible way of dealing with things, but an ultimatum, like this is, you're not getting like this one, no hormones or surgery. In my experience, when these things happen, it is very common then for a person to shift into, okay, I'm just going to be gender fluid or more non-binary femme, again, somewhere in the middle spectrum of identifying. A lot of times this is a person's way of meeting their needs halfway without fully going forward because they're afraid of losing their relationship. First, I want to acknowledge and say there's nothing wrong with that. You know, choosing in this case some form of self-preservation is a normal and natural thing for us to do as human beings. So no judgment to any of you who are doing that. It is very, very difficult when you're in a long-term relationship or marriage and you are very connected to your partner and you really do not want to lose them. It means a lot to you. The relationship means a lot to you. Not everything is black and white where you absolutely have to move toward your authentic self. There's multiple ways of connecting to your authentic self. But I encourage all of you to come to the decision from a place of being more in alignment with yourself, from a place of what's truly true for you, versus choosing to forego your health and well-being and forego your truth and what really matters to you and what would genuinely make you happy out of fear of losing partner. That is one of the things I do not encourage people to do. But if you are coming from a place of genuine acceptance where you're at and genuine conversation with yourself that you are okay shifting to gender fluid or non-binary femme versus complete trans feminine identity, and that's going to be enough for you to deal with dysphoria, to ease any kind of pain. If you're doing it from a real place of acceptance and acknowledging and accountability, that is a very different story. And I have a lot of clients who have done it and are doing it, and there's nothing wrong with that. I always say gender transition is not for everybody, and some people feel that it's not even worth it for them, that the benefits it may bring going through the whole transition are not worthy for them. But the benefits of being honest to yourself are always worthy. Remember, being honest to ourselves doesn't mean we have to act on that honesty. It doesn't have we have to jump into services. I always say just accepting that you're struggling with dysphoria or just accepting your gender identity will go miles and miles for you versus lying to yourself. So this is one of the things that I want to be very clear on. So the way that you can differentiate if you're being truly gender fluid from being trans woman with fluctuating dysphoria is, like I said in the first question, square one. What is your square one? How do you feel about your assigned gender at birth? How do you feel about navigating life as a man? What about it that bothers you? What about it that doesn't align with you? What about that doesn't resonate with you? Second, for you specifically, I would encourage for you to ask yourself, what does your dysphoria tells you? And how are you dealing with dysphoria? Have you noticed dysphoria getting worse and worse and more intense? If it is getting more and more worse and intense, there is a high probability that it will continue so. Because again, dysphoria is that signal when we're not accepting or acknowledging things about ourselves. It's not always a signal that we have to do something about it, but it is a signal to be truthful with ourselves. I want you and anybody who's in the similar situation to also observe whether your relationship to gender fluid or non-binary femme or any kind of male spectrum identities, is that relationship for yourself arising out of that really does feels like me? Or if I were honest with myself, and a lot of times if we're honest with ourselves and really listen to our inner voice, the truth always comes up. Or ask yourself, if I were honest with myself, maybe close your eyes, take a deep breath, and just ask yourself, if I were honest with myself, am I doing this? Am I stepping into this identity because my wife said no to hormones and surgery? What's the first thing that comes up? Alternatively, to play devil's advocate, if I were to ask you today, but what if your wife said, didn't give you an ultimatum? What if she said, okay, let's explore it step by step, and if you want to consider hormones, let's explore it. What would you say then? What would you be feeling then? These are some of the really, really good questions for you to think about to distinguish whether you are gender fluid or if you're a trans woman. A lot of times when we remove ultimatums, obstacles, we find out that our deeper selves is more expensive. For some people, it's much more. It's almost like if I were to ask you, if I remove fear, right? Fear and any obstacles in your life, what would be the answer? So that's something to think about. This is not an easy situation. I'm not a fan of ultimatums, to be honest. If you're been with my channel for a while, you know this. I don't understand ultimatums. I don't think ultimatums can work. Because ultimatums coming from partner are rigid walls that go up. And they have no room for negotiation. They have no room for discussion. It is my way or highway. And I think that when those things are presented, they naturally are going to push a partner with dysphoria to make a choice that is less scary. And the less scary choice might be to choose a middle spectrum identity versus choosing themselves because they're afraid they're going to lose their partner. That's why I don't like ultimatums, because I feel like the partner who issues ultimatums is leveraging your health, and they're leveraging your fear of losing them, your connection to them. And I think that's bullshit. So this is my opinion. My opinion. You don't have to agree with it. Totally valid. But this is my opinion. I would never want my husband to toy with my health and to leverage that as an ultimatum because he's not comfortable with something. Okay? This is just my opinion. And when I work with partners, with spouses who issue ultimatums, I tell them that. And I tell them that, look, you're also being selfish because you're not practicing your choice. You know your partner is now just came out to you as a woman. How do you expect them to live with you and pretending to be something they're not? And what does it tell you about your choices and your decision to remain in this relationship? So, not easy. These are not easy conversations. They're not easy for you. They're not easy for your partner. These are never easy things. To navigate things in a relationship with grace and compassion and humility is difficult. It's difficult. Hopefully that was helpful. That's a really, really good question. All of these questions are really, really good. Again, if you want to participate in Q&A, all you gotta do is email me. Email is down below in description. It's basically info@drzphd.com. Email me your question. Please keep it short. keep it to the point, and I'd be very happy to include it in the Q&A. Hopefully this was helpful. Comment below, share your thoughts, maybe share some of the insight for other people that you might have in regard to these questions, and I will see you all in the next video. Goodbye.